Hi, in this lecture we shall discuss anxiety. We will try to understand anxiety, break down anxiety to know what might cause anxiety and the symptoms of anxiety. We shall be drawing our resource from Medical News Today from the website, and we'll be reading from that website as well as adding some explanations as we go on. Anxiety is a normal and often healthy emotion. However, when a person regularly feels disproportionate levels of anxiety, it might become a medical disorder. Anxiety disorder affects 40 million people in the United States. It is the most common group of mental illnesses in the country. That is the only statistics we have from Medical News Today. In other countries, the anxiety epidemic is growing. Only 36.9% of people with an anxiety disorder in the United States receive treatment. Anxiety disorders form a category of mental health diagnoses that lead to excessive nervousness, fear, apprehension, and worry. These disorders alter how a person processes emotions and behave. It also causes physical symptoms. Mild anxiety might be vague and unsettling, while severe anxiety may seriously affect day-to-day living. The American Psychological Association defines anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. Knowing the difference between normal feelings of anxiety and an anxiety disorder requiring medical attention can help a person identify and treat the condition. The duration or severity of an anxious feeling can sometimes be out of proportion to the original trigger or stressor. Physical symptoms such as increased pressure and nausea may also develop. These responses move beyond anxiety into an anxiety disorder. Some symptoms associated with generalized anxiety disorder include restlessness, uncontrollable feelings of worry, increased irritability, difficulties to concentrate, sleep difficulties, and other symptoms. Treatments. According to the Mayo Clinic, treatment for anxieties can take two types. There is psychotherapy and medications. Some patients benefit more from psychotherapy. Some benefit more from medication. Others benefit from a combination of the two methods. It can take some trial and error to discover which treatment works best for you. Psychotherapy, also known as talk therapy or psychological counseling, involves working with a therapist to reduce your anxiety symptoms. It can also be an effective treatment for anxiety. Cognitive behavioral therapy, CBT, is the most effective form of psychotherapy for anxiety disorders. It includes exposure therapy, in which you gradually are made to face the situation that causes you anxiety so you can build confidence and manage the situation without developing anxiety. Medications. Several types of medications are used to help relieve symptoms of anxiety. Some antidepressants are used to treat anxiety disorders. In limited circumstances, your doctor may prescribe other types of medication, such as sedatives, also called beta blockers. These medications are for short-term relief of anxiety symptoms and are not intended to be used long-term.